When patients come and want their lips enhanced, how do you judge what's right for them? If they come and say, I want big lips, how do you talk them into something appropriate?
That's a very good question. I often look at the lips as the door of the house, if you compare the face to a house.
For sure.
And so my approach is that the house should be in order before you replace the door or make any changes to the
Lovely.
door. Because, beautiful large lips can look slightly out of place. Part of the aging process involves a collapse towards the middle, the center.
Oh, yes.
So this weighs in and sits in on the lips, you see. And so working with the lips from that point of view puts you immediately in a disadvantage. And so the idea then is to bring everything back out, what I call facial reshaping. And that gives you a better chance to get the kind of lips that you're after.
Okay, so face reshaping first.
Facial reshaping always to be considered first before lips.
Before lips.
And then once we decide that it's appropriate to treat the lips, I think the important thing is then to work with the natural anatomy of the lips. So the lips, for example, have little pillows called tubercles. These are naturally occurring structures in the lips, you see. There's 2 on the bottom and there's 3 on the top. Okay, so they form those little pillows that you see over here and also over here. Not always very visible in everyone, but the idea then is to bring them out naturally for a natural result, rather than do the traditional in the vermilion border, the one-fits-all approach, which is responsible for the duck look, by the way.
How interesting.
That kind of thing.
Okay.
Which is something we want to avoid at all costs.
Now, also another slight lip thing, the lip flip. Is this a thing?
Yeah, so
is
that involves...
just ridiculous?
It's a little bit ridiculous because it can affect movement. And anything that affects movement, for example, sucking out of a straw or kissing, to me is not a good idea. And it's a very short-lived effect, which comes from Botox. By injecting around the lips. And I call my procedure the non-surgical lip lift, is to try and lift it from the inside, not inject the border on the outside, which projects it out. So the idea is you want to enlarge the lips on a vertical plane. And that's done by addressing those little pillows called the tubercles and injecting on the inside.
Wow. Okay, so whole new lip education. and taking a look at your Instagram is really the place to see the kind of results you're getting with this, isn't it?
Yes, I show, and I also do video demonstrations of each of the steps. And there's an article published which I've posted on Instagram as well.
Okay, thank you. Thank you very much.